Williams' team says she has been diagnosed with primary progressive aphasia and frontotemporal dementia. These are conditions associated with changes in behavior, communication, and personality. Now, if this sounds familiar, it may be because back in 2022, actor Bruce Willis was diagnosed with aphasia, which has progressed to frontotemporal dementia. The announcement comes just days before the premiere of a Lifetime documentary about Williams' physical and mental health that is set to air this weekend. For more on this, we want to bring in Dr. Romie Mushtaq. She's the neurologist and chief wellness officer at Great Wolf Resorts. Dr. Mushtaq, thanks for being with us. She's also the author of the book, The Busy Brain Cure, the 8-week plan to find focus, tame anxiety, and sleep again. Dr. Mushtaq, let's talk first about just this condition in general. What are some of the symptoms? And, you know, Wendy is only 59 years old. Bruce Willis was young as well. Is there a typical age of diagnosis?
Vicki, good morning, and my heartfelt condolences out to Wendy, her loved ones, and all of her fans. Frontotemporal dementia is a form of dementia that typically happens at a younger age. Average age of diagnosis is around 45 to 65, and it's an actual group of different types of dementia. One type can affect personality, and the type that they're saying Wendy has can affect speech, known as frontotemporal dementia with primary progressive aphasia. Right there, you can see it can affect both the frontal lobe of the brain right at the front behind your forehead and the temporal lobe behind the ears, as we're seeing on the brain scans here.
Dr. Mushtaq, how is this disease typically diagnosed and how does it progress?
Yeah, you know, it's not an easy diagnosis and it can take time. Sometimes the first symptoms are behavioral changes or difficulty speaking. So it's a careful clinical history. In some, there may be a family history. It is not clear with Wendy, and a genetic variant as well. How it's diagnosed is by a neurologist specializing in memory with a careful physical exam, as well as an MRI of the brain, and additional type of imaging known as SPECT imaging that can show how glucose and other tracers are taken up in the frontal and temporal regions of the brain. So it often can take a long time to diagnose and can be a diagnosis of exclusion, which is not easy.
And doctor, what happens next? How is this treated? How does someone like Wendy move forward?
Sadly, Vicki, there is no actual cure for frontotemporal dementia or primary progressive aphasia. Supportive care is what's needed. It's very common to have behavioral outbursts or mood, and there are psychiatric medications for that. Speech pathology and language pathology can help with, prolonging the ability to use language. But the most important thing is that skilled nursing care is given to caregivers, because it can be very difficult to watch a loved one so young suffer.
Yeah, our best thoughts are with Wendy, her family, and her caregivers. Dr. Romie Mushtaq, thank you so much for your time this morning.
Thank you, Vicki.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.